Assalamu alaikum everyone. I hope you are doing great. So today we are going to learn about biasing and its type. Biasing. What is biasing? Biasing is defined as any systemic error in the design, conduct, or analysis of a study that results in a mistaken estimate of an exposure's effect on the risk of disease. Types of bias. It is further categorized into three major categories. Number one is subject bias, which is further divided into two, that is, attention bias or recall bias. Number two is observer or investigator bias, and number three is other types of bias, which includes selection bias, susceptibility bias, Bergsonian bias, analyzer bias, interviewer bias, lead time bias or zero time shift bias, bias in evaluation, naming, prevalence incidence bias, design bias, information bias, misclassification bias, confounding, sampling bias, self selection bias. So let's discuss about study subject bias. Error which is introduced by a study subject. It is further categorized into two, that is, attention bias and recall bias. Attention bias, also known as Hawthorne effect. In this type of bias, a study subject basically alter their behavior when they are being watched. It is also seen in cohort study. Number two is recall bias, also known as memory bias. A study subject don't remember when they get exposed to that risk factor or exposure correctly. Seen in case control study. So now let's discuss about observer bias. It is also known as investigator bias. In this type of bias, influencer may get influenced if he knows beforehand that what type of therapy is being given to the individual. Example is bias due to wrong interpretation of lab test. Other type of bias. Selection bias. Groups are susceptible to desired outcome if biased during selection. Bergsonian bias. It is another type of selection bias which is seen in case control study. In this type of bias, case and controls are selected from the hospital. The control tend to be more exposed than the general population from which the case came from, which leads to underestimation of odd ratio. Analyzer bias. It is usually introduced by analyzer. Interview bias. In this type of bias, interviewee devotes more time with cases, that is, disease group, as compared to controls, that is, healthy group. Design bias, which basically occur because of faulty study design. Information bias, which occur due to inaccurate information about exposure and disease. Misclassification bias. In this type of bias, when some individual who have the disease cases are classified as control, that is healthy group of people. Sampling bias, which occurs when data collection is biased against certain data. Lead time bias, also known as zero time shift bias. It is a bias which occurs due to overestimation of survival time due to backward shift of starting point. Name bias, also known as prevalence incidence bias. This bias occur due to missing cases, mild or silent cases, or short duration of cases from the study. Bias in evaluation. Investigator may subconsciously give favorable report of outcome of the trial. Hope you like this video. Comment down the topic you want the short notes or you want to learn in easiest way possible. Happy learning!